Hi everyone, my name is Michaela McIntyre and I'm a physiatrist at Toronto Rehab. And today I'm going to take you through the abstract for my paper that was called Practical Considerations for Implementing Virtual Care in Physical Medicine and Rehabilitation for the Pandemic and Beyond. I'd just like to acknowledge my co-authors, Drs. Robinson and Dr. Mayo. And this paper was published in the American Journal of Physical Medicine and Rehabilitation online April 2020 and in print June 2020. This paper came from the need to continue providing care despite the physical distancing that came with the COVID-19 pandemic and resultant reduction or elimination of non-essential health services. But recognizing that even before the pandemic, among the key health policy challenges in Canada was long waits for elective healthcare services. So our group was trying to find a way to keep care going. So we wrote a paper that was designed to be a practical how-to guide for physiatrists who are looking to quickly implement virtual care. And some of the themes that we covered included benefits and barriers for virtual care, recognizing that even after the pandemic, virtual care is probably here to stay in some capacity, but there are barriers that we need to consider, especially for our patients who have high levels of disability or low socioeconomic status. We also talked about how to select appropriate virtual care platforms, which in many cases can be telephone first, as well as step-by-step instructions for conducting virtual visits, including the consent process. And we touched on some themes such as performing virtual physical examination and engaging learners in virtual care. After the paper was published, we had the opportunity to do a follow-up webinar through CAPM&R about virtual physical examination with Dr. Winston, which was a lot of fun as well. In terms of next steps, the work around virtual care that I'm doing now focuses on digital health equity, virtual physical examination, and integration of learners into virtual clinics. And I'm also involved in a project about virtual rehabilitation called the Toronto Rehab Toolkit for Telerehabilitation. So lots of exciting work that I hope to continue. Thanks so much for listening to this presentation and enjoy the rest of the conference.